Emergency Mobile Healthcare is an ambulance service. It's locally owned and operated here in Memphis, Tennessee and in the West Tennessee area. We specialize in emergency transportation, ALS with paramedics, non-emergency transportation with ambulance with EMTs, IVs. We also do wheelchair transportation and ambulatory transportation in the West Tennessee area.
Today, EMHC has 16 ambulances in our fleet. We use those ambulances on a day-to-day basis. We may use that ambulance today to take a patient to the emergency room, take a patient to the doctor's appointment, for someone going home from the hospital, or a patient that may be at home and needs to go to a nursing home for an admission. We work with a lot of hospice organizations that utilize our service. Our ambulances are not used what someone would typically think in a 911 environment. We utilize our ambulance to move patients from point A to point B, essentially. The origin and the destination really mean nothing to us in a sense of where we take our patient. We take care of them the same as we would if someone going to an emergency room versus someone going home from a hospital stay.
One of the big needs when we started this business in 1997 was the times that were involved when people called an ambulance. When people called an ambulance, you could wait anywhere from 35 to 45 minutes to an hour, and these were for emergency calls. Sometimes the people that showed up were a ragtag bunch that were just kind of wearing anything that they happened to get out of bed and put on, and to the other extreme where a lot of people were put off by having people come to pick them up that were wearing badges and had all the fire trucks with them and things like that. A lot of the facilities, the elderly facilities that we deal with, the elderly people are frightened by a lot of hoopla and a lot of lights and sirens coming in with fire trucks. What we do is we come in there as a quiet professional medical team, approach their bedside with as much professionalism as they deserve, and quietly take care of their needs, put them in the ambulance and take them to the hospital to get the care that they deserve.
Our dispatch center has evolved since I started working there in 2002. When I first started at EMHC, we had a 2-line phone and we worked off paper. Today we work off a state-of-the-art CAD system that pages our information out to our crew members in the field, that interacts with our GPS units on the ambulances, and it also interacts with our telephone system that we can track every call that comes in, and we are able to know how long it takes to answer that phone call and get it dispatched out to the ambulance to respond for a discharge or respond to an emergency or whatever the case may be. Our dispatchers go through extensive training. We just don't hire someone with customer service background. We hire someone that's more like a medical assistant that has the anatomy and physiology and clinical side as well as the clerical side of the medical office operation, and that interacts very well with our system. We use our EMTs to actually physically dispatch the calls where they know what is an emergency and how to triage those calls, and we're using licensed personnel to do that. It's another service to our patients because they need to know in the back of their mind they're getting the right equipment at the right time for their emergency. Last year, we were awarded through the Tennessee Healthcare Association for 2008 Vendor of the Year, and that was something that we're very proud of. When you're a small, locally owned ambulance service in Memphis, Tennessee, that services nothing but Memphis and the West Tennessee region, to have an award that's given across the state, that says a lot about our people. It says a lot about the philosophy of our ownership. It talks about, it says a lot for our management team and not only our employees. Our employees take great pride every day in coming to work and taking care of our patients. And if it wasn't for our employees taking care of our patients, we wouldn't have anything. From the vision from Mike and Betty and to Bruce Crowder and Lexi and our dispatch center and myself, and working with those employees every day, EMHC wouldn't be where it is today.
We take pride, extreme pride in everything we do, in our employees, in the way our vehicles look, in the equipment that we carry, and being a part of the Memphis community. The biggest part of our work is in the community and helping with charitable organizations, people who aren't even related to the ambulance business. We like to be known as the hometown group, and we actually are.